Nunavut miublat ko pahi. Mana mo tikid lugo 9 arveni nutango yut nuvan na yakaktu ta kwatam ila Nunavu iluani tamang me arveni lutin. Maman na yo Nunavu iluani 49 ta ko nuvan na yakaktu and tamang me arveni lutin. Ta kwat ublumi mutikid lugo kawi hakta hime yut nuvan na yakangi mangata 5,377 and ta kwa 642 huli malik taw yut. Matana na houtit che ya man natana 207 Nunavut miut nuvan na ya kalautu hungilaktu ana runnertu. Mana yotana kaput nuvan na ya tari kutit Nunavu mutikit suma ma atakasuni modernami. Tana tikipat Nunavu miut kapok tawga pata nereu punga ta ko Nunavu miut kapeging ilugo tana nuvan na ya kan nangito mo kapayaw ta kumaput tana kawi haktaw tsak mang mata kwa huinaw ningit maichaw ningit ta kwa kayo haktaw tsak sutit Canada iluani ama hilaryami ta kwa titiliok to pagkata ko Nunavu miutana tamani ilak pa Nunavu iluani kapayaw yak to ta kumaput tano kaktu luak tu ngatana kaputi Nunavut tabani lakpat kapuk tau lakpata kapayaw yak to ma tu nga mata ko tau ilak kapayaw yak to ma mata na kapayaw lu tatana nuvan na yo halagi yu lo aptigo ki hani ami hung luak tu kapayaw patatana tau pingui tu anguna mata na unatang nuvan na yo mi diliok to pagkata ko Nunavu miuta kalimat chaluti kawi hat chaluti kehani tana nuvan na yakan nangito kaput kapayaw yak to kumak puhi tana may yungman amatana okay na hok taka okang nelam ya kata na kowe hung na ulyak nen kowe hung na nelak tiluta kwadjo lang iman kating ngalo tangiluta neriyak to tangiluta iglo ahianut agawer mi chak talugit Nieuwer mora op de katinganer op de kina pa matwang atok taluta dan nala cha op tigo dan nuvan na yo nokanya op tigo dan kaput ama nala cha lewita ko malakoyo yo ta ko tamam atok op tigo dan nuvan na yo kelamiyo na nungun na mat Nunavu iloni mat na yo. Good morning. Today, Nunavut miut has 9 new cases of COVID-19, all in Arviat. Nunavut has a total of 49 active cases of COVID-19. The total number of persons followed to date is 5,377. There are currently 642 persons still being followed, and this is a good number. The next one, 207 Nunavut miut have now recovered from the virus. As we plan for the rollout of the Moderna vaccine in the territory, I hope all Nunavut miut will take the time to learn about this, what this means and why it is safe and effective. I know there are some misinformation and fears surrounding the vaccine. This will be our best defense against COVID-19, and the testing on this has been extensive and thorough. I can assure you, my family and I will all get vaccinated when it is our turn. The vaccine could be the light at the end of the tunnel. Again, we will ask you to do your part in getting the vaccine to help Nunavut and help us all fight COVID-19. Keep washing your hands, wear a mask, and keep gatherings and your bubble limited when you can. Stay home if you feel unwell. Please stay well and please stay safe. Thank you.
Good morning. Last week we announced that Nunavut will likely be receiving the Moderna vaccine in the first quarter of 2021. This vaccine is currently in the process of being reviewed by Health Canada. The territory will receive enough doses to vaccinate 75% of its adult population. As we prepare for its arrival, I want to take this opportunity to talk a bit about the vaccine's development, timeline for its arrival in the territory, and our preparations to ensure that once in the territory, it is administered safely and timely to all Nunavut.
Ola sakut pinasausi ula utuminano na salawata Nunavut tiki biula ngata Moderna na ngata yumikapumi takipinga susivula bangin ni 2021 gulekat. Tana kaputi sulangit to valia gaswata na nangituliri ko kanatami Nunavut ko na matuni kaputi ni tiki biula to 75% ngita ko idnight kapiyagun naksilaktuti. Upalongayak tiluta tikilaan ni ngani tayo mga kausra kayo na kumayong atako kaputi akitsok ta wala ni ngani. Hangak kulang ni ngani tikilaan ni ngani Nunavut amalo pulongayak utivuta ko tikis malakata Nunavut. Awla taot siya alo ni ata nang itukod king vaksamang itukulo Nunavut miulimana.
People have asked if the vaccine is safe. It is. I say that because of the rigorous work that has gone into its development. mRNA vaccines in general have been under development for more than 20 years, and the clinical trials for Moderna alone had 30,000 participants from a broad range of population groups. Canada also has a very thorough vaccine approval process that will ensure the vaccine safety. Usually, we wait months in between development steps for more funding or resources, which slows down the process. The type and degree of global cooperation we have witnessed, the massive efforts deployed to bring in financial, human, and technological resources needed, allowed many steps of the vaccine production to happen at the same time while ensuring its safety every step of the way.
Whatever mRNA.
Sorry.
Kikuti na perisima matatana kaputi at tanang ikalo mga itana at tanang ito. Tana tangip to may pilirang si malaki maakitsok daw vali at hilogo. Tako kaputi, tako akitsok daw vali hatasong galo akago ni avatini. Amalo uturaw daw lunitana Moderna 30,000 no ilaw yo kalaw to tako at jiging ito ni kikuti nang ni ukiulin nilo. Kanatami atang itsiyak tami kaputi ni angyak paliago sa hangat taman na kaputi at tanak tayo hulugo. Tako takkirasang ni utakkiyaw sungalo kaputi liok paliati lugit kinaw yak ni kubalo piliridyotit sanik tako sukkay kutaw sungumata. Kisa ni tako ano nakjami katut sa katigit sa si maningin no tako alami su pilirilarit si maningin no tamak ko kinaw yait ikinayak tit amalo nutangok paliayo piliridyotit sakkiyat sa hulugi tako amisut ataw chiko kamagayaw gunalawak to kilami unaksaw hulugo at tanang ituk ko.
Our planning for the vaccine's distribution is underway, and work has already been done to prepare for the vaccine's arrival. Supplies such as syringes, needles, and alcohol swabs required for administering a vaccine are already in territory. 2 medical-grade freezers supplied by the Public Health Agency of Canada arrived over the weekend and will increase our storage capacity in both Iqaluit and Rankin Inlet. While we know that in the first 3 months of 2021, we will be receiving enough to vaccinate 75% of the adult population, we do not know how the deliveries will be scheduled. With that in mind, we are developing plans based on a variety of scenarios. For example, if we receive a small number of doses at the beginning of January and we don't know how many doses will come in February, we will be taking a very focused approach by first vaccinating those at highest risk of complications from COVID-19.
Pamnaw te hamne votako kapiyaw hatta palyala lakti lugipigas malakto. Upalongayak palyalo talutikilan ni kaputin. Tamako sunakutan sur lukaputing it amalo salumaksay gutiyo yod asingilo tako kaputimot. Atuk tau gaya kasut suli pita kalirik do tamani Nunavut. Makuk an binni iyagak nu ngayo tamako kwa kautit tuniyaw si mayo kanatame ana hang nangituliri kutimi kutingin no tikilaw to pinasaro si unungwani tako to preview si matsaro na lang at tamakini kalun ni kang sinang milo. Kaya magalawak to tako sa bulak pa mitakiping aso 2021 mitako na malakalo ang mga tahila na malam ningin 75% innay kapiyaw gunak sila aluti. Kisani hawi mangittu ko hano aula tau naarningin no hangakku laarningin nillo. Taakko isumagillugi taakko parnautili opalleayu atsigingittunun. Sullu hatsinarni tikibiugutta January upigaangarningin ni hawi manginatta hatsillattaangunaarmangaatalu February mi. Taakko turaaga hatsiarlu tapiliridjusakalaartigu teikko kapiyauqaarattarlutik ulugaanartumiigunnanirsai nuvadjuanak 19 mo.
In a situation where we have limited supply at first, elder centers, long-term care residents, and the staff working with them will receive the vaccine first. On the other hand, if we receive enough vaccines in January, we may look at mass immunization clinics with the aim of vaccinating as many adults as possible. Regardless of the strategy, by the end of March, we should have received enough vaccines for 75% of adults in Nunavut. The key for us, like Nunavut's path, is to be flexible and plan for a variety of circumstances. Throughout this process, it is important to remember that Nunavut's realities require a tailored approach and experience with delivering and administering vaccines in a northern context.
Taakko sivulle me amikakkaakeinarniartillugi taakko sivulliu jaulaartu innakkuvinniittut ippigijauvinniittut ammalu iqqanaajartingit piliriqatoju taakkununga sivulliqpaangulaartun. Taakko naammapataat kapuutti tikilaartu January mi taakko amisuni kapisiqattarumalerajartugu turaaga harluta amisuni amisuunappaangugasuartuni innarni. Qanuugaluaqqa taakko hanurtuurutivun March nunguani taakko naammat sigunnalaartu 75% innai kapiyaussimalliqullugi Nunavummi. Turaaga haqqugullu tamanna Nunavumatuerpalliatillugu taakko asijjirtaqattarunnarluti parnautaaqaqattarlutalu kisui saqqeraippata. Pilirivalliatilluta pimmariuviqqaumagaahartavu Nunavummi adjiungittumiikkatta taakko alu pilirijjusivut atuutiqarsimanivullu aulatsinermut kapuutinik aturlugit ukiortartumuungajuni.
Our health staff has this experience and understands the challenges we face. This is not the first time they have had to work quickly and safely in unique conditions. Every year, vaccination campaigns across the territory come with a number of logistical challenges. During the H1N1 pandemic, our teams were able to plan and deploy timely vaccination campaigns across the territory. This vaccination campaign is no exception. Finally, I would like to ask Nunavummiut to be patient and, most importantly, to use trusted sources of information when learning about the vaccine and any other new public health initiatives. I understand that some of this information is new, but not so long ago, so was COVID-19. And yet collectively, by using science-based facts and information from trusted sources, we have come a long way in understanding the virus and taking the necessary precautions to protect ourselves, our families, and our communities. Thank you.
Ana hannangittulerina miqqanaajartivu tamaksuminga haayimajaqtsiartu tukisiumatsiartu tillu tamakku atsorumnartukkuurutaugunnartuni. Taana sivullerpaangungimmaan khilamiujukkut attanangittukkullu pilirigiaaharnivun. Aqaagutamaan kapiyauhuyaqattaqatta Nunavummi taakkualu adjigiingittuni atsorumnartukkuurutiqaqattangan. Suurlu H1N1 qanimannaaq searmapalliatillugu piliriyivut parnagunnalaurtut kinguvarsimangittuni kapisiqattarunnarsuti Nunavulimaami taimaatsainnaanaarmiu taana kapisiqattaleqqata. Kingullerpaami apirijakka Nunavummiut utaqitsiarunnarhullugit ammalu pimmariunerpaami taakkua sulijuni kisiaani tukisigaarviqaqattarlutik iligumagutti kapuutiumitsaanut taakkualu aanaaharnangittulernermu piliriangujuni. Tukisiumagaluartunga taakko nutaa tukisigiaruti nutaangummata kisiani taimaatsainna nuvadjuarna 19 taana nutaangulaumimman. Kisiani katujjiluta qawisarnermullu sulijuni aturluta taakko ullumimu tukiutissimajugu amissuni tukisiumagunnarsivallialluta nuvadjuanaumitsaani sapummigunnarnermut nammini ilattinnik nuneqqatittinnillu. Yannami.
Kent Driscoll, EPTN National News. Dr. Patterson, there's going to be enough vaccine for 75% of all adults in Nunavut to take it. What percentage need to take it for you to consider this vaccination campaign a success?
Kentrisko EPTN kun niluta Patterson tako 75% ingin kapiu khatalana iga innarnik. Khatsini percentil ya khataman kapiu khatartu kayu sitsam nakaktagun nakullugu.
We'd be looking for achieving the threshold for herd immunity. We're not certain yet exactly what that figure is, but it's probably greater than 60%. The other thing is the supply that we're getting, that's for the first 3 months. If we need more, there will be more available, but it will be later on into the second quarter or later of 2021.
Tako ima toraga haktugu inu khatigi amisuuner say anna majjuti taarun narsikhulugit. Tako kay 60% ngi kapiyaw si malakhatatay ma inu khatigi anna majjuti taarun narsigayartun. Kisani tako takipinga sivulapangin naqagu minutami pikkanera harta kaputini kinguneagu 2021 nungwani tako piyarirum narsigayartun.
Dr. Patterson, it's probably too early to ask this, but I'm going to ask it anyway. I'm wondering best case scenario, when do you expect that every adult in Nunavut who wants to take the vaccine will have had an opportunity to?
Luta Patterson ta nakilami ula pala yugalo kisani akaw na nakpaku tako ilun di kapiyagun naksigun nakatayin na hanugayakha.
If we actually succeed beyond everybody's expectations and get all of those doses used up in the first 3 months, then we may see more coming in the months after that. And if everything works out that well, perhaps by the end of the second quarter of 2021. But we'd have to see how. Sorry, I'll let Uli interpret.
Tako kayu sitsam nakakhaneriw gayavu malilugi kisani tako kaputit atok tawag naksiyo na patatakhi ni pingaso ni sevulak pangin kingunago pikkanero nalakalo waktu tako takhi pingaso nas malakata 2021 me.
A lot of this depends on manufacturing and shipping, manufacturing's capacity and shipping capacity that I don't have control or even full awareness of. So it's a little hard to predict what's going to happen beyond beyond the end of March 2021.
Ako to sana yaw wala ningi nama pala niya kalaw mga tamalo awlak titaw katang ningi tamakoy sa magiyaw gaya hanga tatatso malo awlagun nak nagit ilang ilokaw yamangit sa makitsugit. Stay may manalo nak tutakwa March nungwa ni 2021 piyakir si magunak sila mga ata.
Ulakut togat si visituni ulutuna titligo aperioro rasi tekwa kapiyoyut kalunani ngarpat inutungi luti tiki kautigi yumna kayakpat. On Friday you were asked, I don't remember the answer, but for those who got the immunization shot, can they arrive back to Nunavut even without isolating?
Right now, no. There's limited information on whether or not the vaccine breaks transmission. So in order for vaccination being a reason to skip the hubs, we either need more information or we need to be at or close to that threshold for herd immunity.
Mana yo aga takwa hatsin na ulwak ila kaya maya kalawangin na tatana kaputi tamat suminga sa ang makpalian yo yuminong kaktit sigun ng mga ubaluni anit teliga harun naksigayang mga tukisiga kan narahayak tigo takwa lo ino katigit hatsiuningin anna madjutitarun namning kaya malakingin at tigusuli.
Herd immunity is a term that's been in the news a lot, and it really refers to having enough people in the population protected that if the virus does arrive, it can't go very far or very fast. And so the risks of that of an outbreak like has happened in Arviat is very small.
Taman na tako ino katigyan na madjutitarun na siningita ko pipalayo nito saktaw laki katangat tako sulip mitsikang ngay main amisuunassa innui taakkoa kapijaussa malirtillugit taima seammapalliat sitten ilikunnaruutaulirajangata suulu taima Arviani seammarsimanin.
Teema qauyigutta amma qanuingilluni tikikautigiyunnarsiluni taakko 75% nguinnartillugussuli tikikautigigunnarsilutik. Taakkoari 25% nguyu qanuittaqaaqarayarpat taakko 75% qanuingitillugit tikikautigigunarluti. Taakko 25% li attarnartumitta liqayarpaan. What about if this scenario is approved that those who got the immunization can come in? What about, and this happens within the 75% of the population and it's still going with that 75%. What if that isolation is eliminated? What about the ones with the 25% who are not immunized?
That's part of why we'll be doing the work needed to ensure that the people who are at highest risk of complications, elders and people in care homes will get first, will ensure that they get the vaccine. And if we do get to the point where we've administered all of our allotment in that first quarter, we will be asking for more if there are still people who want to get the vaccine.
Tamanna ilagijaujo teimeimma taakkoa sivuliujaut näärteqaugakki uluqaanartumigunnarnerseen suulu tamakkoa innait ammalu tamakkoa ippigijauvimmit tuangeqqamiittu sivuliujaugajangata taakkoa kapuuti ilunati atortaugunnarsiniaqata sivulleqpaanginni taqini pingassunik taimaqaakkanningagut kapijaujo hakkannerattaqumappa tutseqakkannerajartugun.
Megan Dooling, Nunatsiaq News. The H1N1 vaccine was in 2009 before people got information online. With so much information on the internet potentially stopping people from getting the vaccine, what will the GM be doing differently now than in 2009 to ensure 75% of the population is vaccinated?
Megan Dooling, Nunatsiaq Unnitana H1N1 Hanimannautillugu 2009 mitakua harisaujakku tukisigialausutik ilangi kapiasulersutik kapijaugu maqattarunniiummata hanuli Nunavut government alunaersissamaniaqatamakko 75% tingi innai kapijaugunnarsequllugi.
Part of our plan is going to be a communications effort, including social media, on internet postings and others to ensure that people have access to correct evidence-based information on this vaccine or any vaccine that we wind up administering in Nunavut.
Ilagijaujo tamanna tusaumatitsigаарnermuuqan pileriaqatsiaaleraaqatta harisaujakkullu tamakkuat ikiarrivikkullu atuinnautitsiarlugi tukussinatsiartuni tammarsimangittunik kapuutiumitsaanaru hanuttuina kapuutiumitsaanaru.
And you advise for people to use trusted sources to research the vaccine, and you say that you'll provide some of those as well. But can you give some examples of what to look for to discern a good source? Like how does somebody know that it's reliable information?
Qawsaqaqqaugubi tamakkoa suliyunni kisaani tukisigiarbiqaqattaqullugit suurlu kisuuva tamakkoa tukisigiatsiarbiugunnartum.
That it comes from the best thing, that it comes from trusted sources like Public Health Agency of Canada, Health Canada, that it doesn't rely on anecdotes that can't be verified, and that it's properly cited and that it's showing up in more than one site.
Tamakkoa tamakkuninga suliyornartuningatsiaqattaqullugi suurlu taakkoa kanatami anneaharnangittulerinaarmutimequtingit anneaharnangittulerajikkullu kanatami tamakkualut uqausiutuinnarsamaayuni tusatti ilaat sulayok sa katangillutik nalunataw sa mangitunik ang maluataw sa ilamakwatillo ni sakikatak hatatay masulin ng imaliluwin.
An example of misinformation would be one that's making the rounds of somebody who's supposedly lost a foot due to the COVID vaccine. And they had pictures of it, but didn't tell you where it came from or give any details. And when some investigative journalists tracked it down, the individual had not received the COVID vaccine and their medical problem had absolutely nothing to do with it. But the only way you could tell was that it was not properly cited, it was not transparent, and so you couldn't, it was impossible or very difficult to verify anything that was in that post.
Sulo tamakwa suling ito nito kisigay ako tiyo ni sakir to kalam na kasulo kakto kakay isigay ngagro nakatuminita ko kapidaw lang ng mutamakwa suling ito gunang ata kaway saktaw sa alo ni solo Pilipivalya yung lagi na taman na kaway patanovad yung anak kaputi may ngangit patay matamakwa taga suling ito nalo na tawag gunang ito sulit yung kajaw kataka kajang ito. Time at last of it. Sorry.
Trevor Wright, Nunavut News. What role has the isolated nature of Nunavut's communities played within this current outbreak here?
Trevor Wright, Nunavut News kung nita ko inuto may katak to Nunavut mula tinagi kano tigay kayong nakaksima ba?
It's helped protect communities by reducing the opportunities for spread into Nunavut. But as with all delivery of healthcare in remote or isolated communities, it's complicated it because it's harder to move staff and supplies around as needed.
Taman na kayong nakakasimayo sa pumigaw tao sa malunin nun nalinig. Tako alo pivika ko tao sa mama tako tikigong nam ni ano nun avumod isolitab bekak to tao sa magong nasuni. Tamakwa kano to inaulat siniyo dyan na hanang itulirin ang mga nunalin niyo nga sige ito tini ayong nakatangan tamakkunung kanayak tinulo sunak ko tanulo note sa katanang mo.
For the vaccinations, are you guys trying to get a majority in each community or just, I guess, a majority in Nunavut overall?
Tako kapiyaw lang ningin namin suna pa tunin nunalin niyo lakaw balo nunavu atangip tugo.
A majority in every community.
Ami suna pa ang waswak tunin atunin nunalin ni.
Kent Driscoll, APTN National News. Dr. Patterson, Rankin Inlet, Whale Cove, and Santa Kilowak have all had cases and recovered. Now, Arviat is still getting new cases. What is the difference between the outbreak in Arviat and the other communities? Is it a function of the conditions on the ground? Is it a function of how it spread initially? Sort of take us through what's different with the Arviat case.
Kent Driscoll, APTN kuniluta Patterson tako kang sinami tikiradjami sanikilo amilo. Taman na sa mapalyan inukhatitagun na si mama tamalo avyan itakuhatak tiluginutan sakit to hapalyan na tilugo. Kano kaya nga ita na avya pidyo tigilugo tay maadjyung inakakasya mapalya viyong inangasuli.
There's a number of factors that might be contributing to it, and it's going to be hard to know. Well, right now it's impossible to know for sure which ones are the major ones. Looking at comparisons to other communities is helpful, but it only gets you so far, and I'll let Uli interpret that, and then I'll list off some of the ones we're considering.
Adjing ito ni pinchuti katuwid na kaya tamakwa sumasaya mapalangin na tang mga tamaham na ayok lalo na yung nangit sa taka sumapidjuti kang mga kisani haus kalang ayong atakwa pilo ang ako tiyagun na ito ni tamat sumasaya mapalangin no.
So it had certainly spread further and farther by the time we were aware that COVID was in Arviat than it had in other communities. And by that I mean there were more infections and there were more households involved. So something triggered that, and we don't know for certain why it worked out that way. There's also higher average occupancy rates, like a greater number of people per household on average in Arviat than most other communities. And we do know that 80% of people or more either don't infect anybody or only infect one or two people when they have COVID, but for some reasons that worldwide is a bit of a question. There's this, every once in a while somebody becomes a so-called super spreader, and it's not necessarily because of anything they did, it's, we don't fully understand what causes that. And so it may have been partly bad luck that there was at least one super spreader in Arviat, but not in the other communities.
Tamanna sama palleani qawilawqattigu tikisimaliriirtillugu arvaani qawiyauna saamnenqaqqaite maimatakku amisuunersait saammarbiussimalilawtut amisuunersaillu illumuiqatigi tamanna nalunait saarunnangitaqaluavu kisianittau tamakku amissuuiqattarningi illumiuqatigi amissuuqattarninginnu tamanna saamma palleallarigu taussimammiyo taimata qawissamagatta ilainnangitaakku saammaq sittailigunna suugalua kisianittau ilangi nunarjuami qawiyaussimayu tamakku ilangit saarmarsinersaugunna suungummata atangertumi tukisiumallaritingitaqaluavu kisiani taimaanalunangittu ilangi saarmarsi qattarningi amisuunersani saarmarsigunnarngata.
Dr. Patterson, one of a big motivation for people to get this vaccine would be, aside from not getting COVID, you'd be able to reduce some of the restrictions that people are facing. Now, from what you've been saying initially, that's not going to happen right off the bat. I'm wondering, at what point will people who have taken the vaccine be able to start avoiding some of the restrictions?
Luta Patterson taanna ilanga kayungirutauma kapiyaugunnanermut imaila nuvadjuanartaartailin nermuugalua kisianittau tamanna kayungirutaugunnaanga kapiyaugumaluti innui tamakko isulittaqbiuyut isulippalleatti taulequllugi mateerpalleagunnarsequllutat tamanna naluneereaqunnaqium.
It's a good question, and I don't think anybody really knows the answer right now, and this is a question that jurisdictions across the world are going to be trying to answer and come up with a plan for over the next couple of months. Bottom line is, I don't think it's going to be, a sudden, we've hit 50%, so we're going to get rid of all of the public health measures. I think it's going to be a gradual decline as the numbers of vaccinations go up beyond 50% or so, then we'll start to see measures being eased bit by bit to figure out what the appropriate level is at that point.
Napequtitsiangugalua kisaini maanna qawiyimayaungittu nunarjualimaami taakkua qawiyigasuangata qangakku matiirpalleagunnarsilaarmangata taakkunuinni maqquunni taqqiinni qawi ila tukisipalleaniartaqaluavu kisaani taanna pijjutituuvu matuitsautigijjaangittu suurlu imeiligunnangittugu abbangi kapiyausamaleqqata tamakkua aannaahornangittulerinamu malittaugiatogunniiqajartu kisiani taakku sukkaittumi matiirtauvallialeqajartu suulluqai 50% kapiyausamaleqqata tamakku aannaahornangittulerinamu malittaugiali sukkaittumi qasujauvallialeqajartu kapiyaussimavallialertillugui.
And the biggest question on everybody's mind is when will the isolation hubs go away? And the bottom line is as soon as it's safe.
Tana pekutiuna pangu yutaku anitteiliga khaliqayarmanga gunneeqaaqaqayarmanga tatujurmivimni watuinnarunnartunga ima attanarunni qakissaani taakko tujurmivimni anitteiliga tugunniilaartu.
Tobiutak CBC-kunnin unikkaarunarpii qannuimma nutaqqallu qitorngaksariillu kapiyoyunnangimmangaat. Can you tell us why children and pregnant women are not approved yet?
The research, certainly on children, there's research going on right now, but it takes longer to recruit enough children to ensure that the vaccine is both safe and effective, and so we may not know for several months if this vaccine is safe for children. If it's not, if either the Pfizer or Moderna vaccines are not, there's at least 2 or 3 more that are scheduled to be reviewed later on this year, and we could look at one of those for children.
Kaya saktaw kang masulita magkuasulo at tanang igaya at tanang ikalo ang mga asurusam nun. Takwalo kaya saktaw wala tilugi kapu at tanang mga ako niyo sa asurusam ni kaya sarutit sa ni ayong nasungumat at tanang itumikalo ang mga tutikat siya kaya kalo ang mga lo. Kasi ani takigalan ni taman na kaya saktaw wala ni ato at tanang gayang ikalo ang mga asurusam nun. Tako Pfizer amalo Moderna tu ina ulit katilo tako kaya sakta wala sin nakakan ni nga guping asut makuping asuluni asing ikaputi kaya sakta wala na may mata at na kayang mga talusosam no.
Tako kaputik se akikadjangi but you can't meet it. Will these immunizations be free as Yukon said it will be for those?
Yeah, these vaccines, and the federal government, and I think all governments have made the same commitment that they will be free to all residents.
Tako kaputi tayo mga gavamato kako kaksimayon ila gavamalimano kaksimayo tako akikadjangit to kikulimano.
Megan Dooling, Nunatsiaq News. You said on Friday that there's various reasons that people in Arviat might be struggling to follow the rules of isolation. And you said that there's ways to deal with that and to support them besides enforcement. Can you give some examples of things that you're doing to support these people?
Megan Dooling Nunatsiaq News alimang may kalawa kabita ko at Arviat at surun na tukuro te karningin no tako malit malingila sa katang atanit tayo ligya hamnang mikta ko aloy kayutit sa hamnang kailaw kabikiso mga tatako kayutit sa nalunayay.
A lot of these are community level efforts, things like providing gift cards to enable people to get food and other supplies that they need, delivering hampers, things like the radio shows from the mayor and others going online to communicate that way. All of those things play a part in reinforcing the message and supporting people in staying home. Enforcement maybe is needed. We've seen that in other circumstances, but it's I was trying to get at it's not the only answer to ensuring that people stay in isolation when necessary.
Tako ano nalin ni tayo may ilong katak to kano ikayok tayo kuti uyot surlo ni kubiutit sa ni out tayo nito ni siya katak sutik. Tako ano kita kutit sa ni kubalo kisuta kutit sa ni amalo ni kini ito bimito ni at sa katak sutik ang ikariyaw yun. Nalaw tik ko to saktit siya katak ningin surlo ta na mayor to saktit siya ang inakatak na aktaman. Tako ilo natin ilagay yaw yu taman na ikayok suy nang mukikutoy na ang ikasi makatak nagsawag na sa kulugin. Ilanik ko malitaw kay gaya kalaki katak sa magalawak to kasi anitaan na pidyo titungin mata ko inuit anitay ligon na sinang munalat siya kung sa kulugin.
Will people in jail in the territory be prioritized for a vaccine? Why or why not?
Tako ano lat si Vimito si Vulio jaw katawla ka kapiyaw ng mo.
There's mixed evidence and guidelines on that. On the one hand, we know that congregate housing, 50, 60 people living together in one facility is a concern for easily having a significant outbreak. On the other hand, the single biggest risk factor for severe COVID-19 disease is age. So if the people in a correctional facility are younger, it may not be appropriate to divert vaccine to that group.
Tako at sige ito ni sakit tayo kasi mayo maligtaw galin ni surlo kating kayo hatil lugo 15 ni 16 ni lo ni tako namituin na surlo ano lat si bimitaman na kilami alo siya mabiugun nangan. Kasi anitaw taman na ulugan anak tumi nakpakaw sa katakat di kuno vatyo anak tumi taakko ukiuqqortunersain suulu tamakko ikayortauvimmiittuut ukiukinnersauqattangata taimaa kapuuti taakkununga toraatitaungaangikainnarsimagajartusivullerginni.
With that said, it is one of our contingency plans, depending upon how much vaccine we get in the first few weeks. And so we've reached out to corrections and operators of shelters to find out numbers of people that are typically living there, along with the numbers of staff that work in those facilities.
Kisanittau parnautaharsimammiugu taakkoa qanutikikittikibbiugutta kapuutinik pinasoarusinginne sivullerpaanginni tamakkua parnautiussimayu suuluikayortauviliqiji tammalu angiqqaqangitsukkuvimmiitut apiriaussimayu qatsiniinu qaqattarmangaata ammalu qatsiniqqinajarteqarmangaata.
Trevor Wright, Nunavut News. There are reports in Arviat that the local co-op has held a scavenger hunt. Would they be facing any penalties for that, or?
Trevor Wright, Nunavut News kunni taakkoa guutusarsimamata Arviami taakkoa koapakkungi ima qinaajartitsilaungata taakkoa inertirtaugiarnaaqubbalu akiliittitaunaaqqa.
My understanding is that there was some contact between the enforcement group and the co-op. They would really only face fines or a warning if it was shown that their plans violated the public health orders by triggering some sort of organized social gathering.
Tusarsimajakku taakkoa uqarbiussimayugaloa taikkanen imalittaukkeeyiinu kuapakkullu taakkoa kiseen akiliititaugajarngata taakkoa parnautiqarneqqata taimaa siqumitsinermulaanaarnangittuleриnermu malittaugialinni katititsinermu innuqasanni taimaa sulinalunertausimangittu.
How goes the monitoring in the remaining communities outside of Arviat?
Tamannali qaisserpalleanisi Arvia silataani nunalinni qanuipalleava.
It's going well. We continue to use charters across the territory, but especially in Rankin, Whale Cove, or not Rankin, sorry, they have their own lab, but in Whale Cove and Savikataaq. And so our turnaround time on tests is reasonable for pretty much all communities.
Tamanna qanuingitsaartu tamakkualus qangattatitau yukku aullarbiunginnaqattartu tamakkua qauyisaqutini aitseqattartuti tikirarjuami sanikiluarmilu ammalu utisaqaikunnarseqattartu tamakkua qauyisaqtaugukkiminingi qilamiuyukku.
Ken Driscoll, APTN National News. Dr. Patterson, at what point do you offer people in Arviat a different place to isolate in order to slow down the spread within individual homes?
Kentrisko APTN kuniluta Patterson qangakku Arviani taakkuninga inigiyaugunnartuni assinginnatuinautitsigurnalaaqqiit tamanna nuqqartitaujuumigunnaqullugusiarmarpalleaninga.
That decision's typically up to the outbreak team, including a public health physician that's been involved with each of the communities. The difficulty in Arviat is that the number of people who who could benefit from isolation outside of the house is much higher than the number of units that are available in the community.
Tamanna isumaliutiugajartu taakkununga saarmapalleayulerinarmu pileriqatigiinut ayumnarutau Arviani taakku amisuuluarninginnu taakku pivaallerutaqajangimata angiqqamiuqatigiini anisit asaanuortausimammata amisuuluarninginnu taakku initaareaqaqajartu assinginni.
The other thing is that by the time an individual is identified, we know that at least 50% of the transmission acquisition, the spread from one person to another or more, has already happened in the house. And so moving out at that point is not very effective at stopping the transmission.
Tan tausimagijaugia harmimma tamakkoon alunartausimalertilluginuvatjuanartaarsimayut 50% nginni taimaa siarmarsissimaleriiqattangata taakko illumiuqatinginni piluartumi taimaa anitaugia harmimmu tamannaatuutiqarunniiqattanga taimaa noqqartitsigutaugajarngimma siarmapalleaniuyuni siarmarsimaleriiqattanga ilangani.
And it's important to keep in mind that although overcrowding makes it more difficult, it's not a guarantee. We do know of houses with that are overcrowded by any stretch of the imagination, but have managed to limit the COVID-19 infection to just 2 or 3 people within that household. Takes a lot of work though, and hats off to those people who have done it.
Pimari uweka mayaw kaya ninga tamako illo mi katigi ni tako ser magbiulat ta kaya ningin nalo na taw si mangiman kaya si magata illo mi katigi ami sugalo aktil kita man na isulit tabi akti taw kunna nga makuping asulo ni tako ser magbiu kaya lotik kisa na churuti katser loti tay matay ko upigi bakka tay maile kunnak si mayo ser maktit tay lim nakmon illo mi katimining.
Has there been anyone else charged or fined for ignoring the Public Health Act in the COVID restrictions?
Kinatuin na akiliti tayo yung kaksumabay, nagtiriyak tayo si Mayo Kakalonis, kumitsin ng mo, anak ang mangituloy ng mo pikuyami.
Not at this time, no.
Manayaga.
And then one more quick one. I'm wondering about the people who have been medevaced to southern medical facilities. The number you've given in the past is if it's more than 5, you'll tell us how many. Is that number more or less than 5, and what more can you tell us?
Kakolik Kamatayo ko tuwa na to ko lapti tayo katakti ko sa kailangan yung navigate lima ito nga ni pata lima yung matano sa Malacca.
The number's under 5, so we won't be giving out more information right now.
Sulitan lima ito nga ni mga ko sa kajang itabo.
CBC kunni tobi utak tema Trevor apere kaumakano nunari tunasakta ng mga kiudlu inugia 75% parukay takwa nunari inukin naksay 500 tungani tud takwa tamay ni kapiyaw yun nakayakpan. With Trevor's question, he asked, what in communities, how many are going to be immunized? And you said majority of the population. What about for those communities who has population under 500? Will the immunization be 100% of the community, or is it going to be rolled out differently?
It won't be rolled out any differently based, community size will not affect that much about how we roll it out. The only thing it might mean is instead of bringing in a bunch of extra staff to get it done very quickly, we may rely on the staff that are already in the community to distribute the vaccine.
Tamako kapiyo kata palyalak kata tako ano nali ang iningi tis magayaw dyan ito. Tako sula mi sunak sa kapiyaw ka sa katang na nga ta sula kanayak tinilo ni kay tikitit siga kang ito nakakaktagot nunalinan na bin ito ni taman nakaputit la kapis sa katang ni kamagayaw bunak sila panlayman.
Megan Dooling, Nunatsiaq News. On Friday, you gave us an update on the rapid testing in Winnipeg. Can you give an update how many more people have gotten tested and the results of that?
Megan Dooling Nunatsiaq ni talim mo kayo ga vekila mi yo ko kaw isa ko tinik Winnipeg mi pigyak to kalalang ni kailo ti khatsu si Malacca ulumi mo.
Last I heard, we'd broken 50 tests. No, other than the one, there's been no other positives.
Tako 50 si mayo kayo sakta kung naksis si mayo ng malunova dyan naktuloy ni kayo yung kalawang ito.
Does the GN have enough staff to coordinate the vaccination rollout and administering it and communicating with people when they need to come for their second shot?
Nunavuga kung inakanayak te katsa kata makuha kapiyaw katalik kata kapisi katalak to ni kamalo to sa matitsi yulak to ni solo to le ani kapiyaw ga kanila mimata.
We may need to hire some extra staff or recruit extra staff to administer the vaccine in terms of planning it, shipping it, and taking care of those other parts of the process. Yes, we have the staff needed to do that.
Ako iqanayartitaakan nituinariaqalaartugu tamakkuninga ikayorunartuni kapiseqattalaaleqqata kisaani tamakkuaparnautauningaullartitauqattarningillu aaqqit ila imaanna iqanayartiinaammattu